Plus, I would also like to thank Asian Heart Hospital for providing us good hall for press conference, plus the premises for flag of the this auto rickshaw rally. Thank you. Now I request Dr. Robert Montana to explain the idea behind this rally.
Okay. Well, you did a very good job, I think. So my name is Dr. Robert Montana. I'm from the United States, and I'm an emergency medicine board certified physician. And for the last 3.5, 4 years, I've been trying my best to do more work outside the United States than inside. And back in 2008, our summer of 2008, I went to Feripur, UP to work at a rural clinic that was under the control of Clara Swain Hospital, one of the first women's and children's hospitals in India. And while working there, I heard of the Bihar flood, and given some of my experience, I decided to try to go help out in Bihar with the flood disaster. And that's how I met Dr. Ravikant Singh there. And from there, he's done a great job, obviously, as you know from his recent award in London. He did a great job in Bihar, and we've always stayed in close contact and wanted to do something together. In the last few years, another thing I've done besides medical care is done some more adventure type things. Like I was a physician for a group of people from the UK who drove antique cars through India, and I took care of them as their physician. And I was in South America with my friend William, riding motorcycles to raise money for charities. And it was at that point I decided it would be fun to incorporate both the rally to raise money and also the medical and public health component, to bring them together. So instead of having people just raise money, we actually not only raise money, but along the way when we stop, we actually try to get to know the community and help them. So that is why we are here today. This is sort of, we have a few different aspects of the rally. Number one is the free health care to the people of India. Number two is the important public health message, the anti-tobacco, which Ravi, I think, did a great job explaining. The third is to have a professional and cultural exchange between the physicians here, Indian doctors and American doctors, because I think I learned a lot here in India when I was here before, working besides the Indian doctors and meeting Ravi, and I wanted more young doctors in America to not only come and work in India, but work side by side an Indian counterpart, so they can know how they treat patients here, how they live, what's it like for them. So the idea for the rally is we pair each up. They drive together, they live together, they eat together, they see patients together, and hopefully by the end of the month they are very good friends, and hopefully this kind of relationship will grow. The fourth aspect of the rally is we're raising money. In the United States, we've raised over $20,000 US, and a third of that will go to Doctors for You for their Slumrise clinic here in Mumbai. A third of it will go to Cross Cultural Care's clinic in Feripur, UP, and a third of it goes to the rally costs. And then the fifth component is just the adventure component, doing something a little different. As you guys know, we're not going to have drivers, we do this ourselves. So I think that's about sums it up, and I just want to thank all our sponsors, and especially Dr. Ravi Singh and Doctors for You, because they've done a lot of the work here and have helped us tremendously, and if they weren't involved, there's no way we could do this. And I think we're going to have a great time.